So, having discussed respiratory system, we're now going to look at asthma, which could be a life-threatening situation. So, if you look at the screen, we'll see your normal airway. You'll see that there's a nice, clear, round space in that tube, for want of a better word, where air passes through easy. So, when somebody has an asthma attack, what happens is that airway becomes constricted, so you don't get as much oxygen air going through. So what do we need to do with somebody having an asthma attack? First thing, you must recognize signs and symptoms of a heart attack, of an asthma attack. Difficulty breathing. They will have difficulty breathing. They'll be struggling for breath. They could have gone silent in severe asthma attacks. Wheezy breath sounds originating from the lungs. Remember your diagram previous. In the lungs, what's happening? You're getting constriction down in the bronchioles. Somebody will be fighting for breath. Other signs and symptoms: difficulty speaking. They'll need to take a deep breath in the middle of a sentence if it's possible. Pale, clammy skin. As we discussed previously in shock, first thing that starts shutting down when your body doesn't get the oxygen round, when your body's going into shock, your skin changes colour. So it'll be pale, clammy skin. Grey or blue lips and skin. Fancy word, cyanosis, you'll see blueness around the lips. Use of muscles in the neck and upper chest. People have accessory muscles in the neck. People with asthma that's having an asthma attack rely on these accessory muscles to breathe. Exhaustion in a severe attack. They may become unconscious and stop breathing in prolonged attacks. So the first thing you must do is reassure the casualty that everything is going to be okay. What we need now to do is recognition. Silence in asthma is not good. It is deadly. Like we said before, it could lead to a cardiac arrest. So what does this person need? First off, they need a reliever inhaler, normally blue. Now if you look at the diagrams, you'll see the adult using the reliever inhaler. You'll see the child using the reliever inhaler with a spacer device. So keep the casualty upright, head slightly forward, use a spacer device if possible. The reason being, if you look at the diagram with the child, when he sucks in, the full metered dose will go into the spacer device. The adult one could lose some out of the mouth area, so it is recommended that you use a spacer device if possible. Do not lay the casualty down, and do not take them outside in the cold air. That will have an adverse effect on them. So reassure them, keep them calm, get them to use the inhaler. Once the attack is relieved with the use of the spacer device and the inhaler, reassure them everything's going to be okay. If you don't see any difference after they've used the inhaler, don't be frightened to ring 999. It is an emergency, an asthma attack, and the patient does need to be monitored.